My name is Dr. Richard Horowitz. I'm a board-certified internist. I'm working in Hyde Park, New York at the Hudson Valley Healing Arts Center. I've been in practice for 26 years. I've seen over 12,000 Lyme patients. I was one of the founding members of ILADS and past president of ILADF, of the International Lyme and Associated Diseases Educational Foundation, which primary importance is to train doctors and educate physicians in helping with the spreading epidemic of tick-borne disorders. So yes, I got into treating Lyme disease when I came to the Hudson Valley, because the Hudson Valley in New York is one of the most Lyme endemic areas in New York State. So when I moved here from Bayside, Queens, having finished my residency, I didn't realize I was moving into one of the most Lyme endemic areas in New York. So I was taught in medical school to always get to the source of a problem, and patients were coming in with EM rashes, and 75% would get better with antibiotics, but 25% would keep relapsing, and I wanted to know why these people didn't get better. So I started searching for answers. And what I discovered over the years is basically what I've now come up with is a 16-point model, which I call MSIDS, Multiple Systemic Infectious Disease Syndrome. These patients stay ill because they don't just have Lyme. They have other strains of Borrelia, like there's now Borrelia miyamotoi, which is a relapsing fever from Japan. They have viruses that are getting into the ticks now with the Heartland virus, and some people have Powassan. There are co-infections like Babesia, parasites that are keeping my patients very ill. So for example, in the first couple of years of practice, a woman came in a wheelchair. She'd been ill for 6 years, disabled, had spent over $500,000 in disability monies from New York State, had seen a good Lyme literate doctor, did not get better with Lyme treatment, and when I found she had Babesia, which was not supposed to exist in this area, she got up out of the wheelchair and walked for the first time after 7 or 10 days of Mepron and Zithromax treating her Babesia. So these type of stories are absolutely amazing because, number one, it's gratifying as a physician to see someone sick for so long who's been not able to get better, and also to find out the role of co-infections. And this is very important because all of this debate about whether Lyme persists or doesn't persist, or is it autoimmune, this model that I'm using is basically showing that it's not one problem as to why these people stay sick, and that's what I'm teaching to the doctors who come to train with me. I'm teaching that you need to hit the cell wall forms of Lyme, the cystic forms of Lyme, the Borrelia that's intracellular, the biofilms, but you also need to hit the co-infections like Babesia and Bartonella and Mycoplasma, and these patients don't detoxify well. So they do very well with glutathione and detoxification protocols, and they have heavy metals. But their hormones are also low. I see young men with low testosterone, patients who have low adrenal function, who are another gratifying story. 13 years sick, literally ready to commit suicide because he was so sick. And after finding he had low adrenals and treating his adrenals, he went to like 85 to 90% normal after 1 week on adrenal support. When you've been doing Lyme for this long, for 26 years with over 12,000 people, you realize that it's literally like 16 nails in people's feet with this model of MSIDS, and you can't just address the Lyme. You can't just address the co-infection. If someone comes into the doctor's office with 16 nails in the foot, the doctor says, okay, you've got pain in your foot, let me see how many nails I can find, but unfortunately most of the classically trained physicians, they only treat the Lyme. They don't know to treat the co-infections, the heavy metals, to detoxify, to get these people to sleep, to treat the hormones, if they have mitochondrial dysfunction or food sensitivities or allergies. All of these things can contribute to their staying ill. So I pass this on to the ILADS preceptors, and it's been very gratifying because people come back to me and say, wow, doc, I learned to treat the co-infections. I did detox with glutathione. These patients are having great results with their cognitive functioning. So it's gratifying because I've been able to make a lot of headway over the years looking for answers. It's a lot of fun when the doctors come for this preceptorship program. I meet new people all the time. We have friendships that develop. So it's very gratifying because people go home and then they start helping their patients, and I feel like we're making a difference. And I wanted to make sure that I really pass on what I've learned, and because I don't have all the answers, no one does, but I've been searching for answers for 26 years with over 12,000 people. So this book that's about to be released through St. Martin's, Why Can't I Get Better? Solving the Mystery of Lyme and Chronic Illness, should help a lot of these ILADS doctors and other physicians who either can only spend a week in our practice but really need the overview of what I do. This book explains it all in great detail. And there's an addendum in the back of the book for physicians. So I think it will be very, very helpful for the doctors who just don't understand this disease. And it's all heavily scientifically referenced. I have hundreds of references in the back of the book. The physician training program, I think, is essential at this point because Lyme disease and tick-borne diseases is the #1 spreading epidemic worldwide. So if we have a worldwide epidemic that's mimicking chronic fatigue syndrome and fibromyalgia and autoimmune diseases like lupus, rheumatoid arthritis, MS, and all of these people are coming in sick, they've seen 10 to 20 doctors, the doctors out there didn't know how to take a history to tell if it was Lyme. They didn't know how to interpret blood tests. They didn't realize that the ELISA was not a very sensitive test. So our job at ILADS is to train doctors and to let them know what the science says. Yes, there are debates right now as far as what's out there, but we at ILADS give them the hard scientific facts. We show them what's in the medical literature. We'll tell them about the controversies, but we train doctors in a way that patients clinically get better without harm. So the point of our organization really is education, and this is a worldwide epidemic. ILADS is a very important organization because as the #1 spreading epidemic for tick-borne diseases, mimicking every disease known to mankind, Alzheimer's, it mimics all these diseases, and it fools doctors because it's the great imitator, just like syphilis was years ago. So the organization is very, very important, and the ILADS training program, you can't really just read this in a book. It's important to train with doctors so you see firsthand how the doctors institute these models. And this way also we create these bonds and relationships that they can email us and call us when they have problems with their patients. So at this point, I think I've trained probably close to at least 100 doctors over the last 15 years, whatever ILADS has been in existence. I was one of the founding members. And it's been great because I'm in contact with a lot of the preceptors. They're very grateful. The patients are getting better. And it feels good when you know you're making a difference in the world where people are really searching for answers and so many people are suffering. It is, I believe, a transformative experience for new Lyme doctors because Lyme is very confusing for doctors. They hear a lot of information, some of which they've gotten from the internet, some of which they've gotten from their community. It's important to speak to doctors that have experience. Just like when you go through medical school, you could read things in books, but you want to train with doctors who have clinical experience because it changes your own understanding of the disease. So I would say that the training program can really be transformative because you see firsthand how I integrate this 16-point model with patients when you spend a week with me. One of the patients who just came in, you'll see that, yes, it was the hormones or it was Bartonella that was causing the neuropathy. Another patient, you'll see that it was just changing this anti-malarial regimen for Babesia that made all the difference in the world. But it's different when you see it firsthand than just reading it in a book. So I think we really need to expand the training program to get as many doctors as we can to go through it. And I'm very happy that the International Lyme and Associated Diseases Educational Foundation is being able to do this type of training because there's no other organization who's doing it at this point. So my personal experience is it has been very gratifying, and the doctors have gotten a lot of help doing the program. So I think it's a great educational experience. Yes, for more information, please contact ilads.org. It's a great organization. I would really encourage doctors to join the organization. It's the only way that you're going to get properly trained at this point because your patients are coming in at the point with this disease. It's mimicking chronic fatigue and fibro and neurological disorders. If you want to help your patients, you need to understand Lyme and associated tick-borne diseases, and ILADS is the organization that's really training doctors. So we need you to join us. Please, please come join us and keep learning about this because this is a spreading epidemic.